Hi everyone! Our seminar today about endometriosis, presented by me, I am Faris, and my colleague Fatema to Zahraa Abdullah. So take interest with us. Before we talk about the endometriosis, we should know the normal physiology of the female genital tract, especially the uterus. The uterus is a hollow, thick wall, pear-shaped organ, located in the pelvic cavity between the bladder and the rectum. The fallopian tube leads into the upper part of the uterus, one on each side, while the lower part leads to the vagina. And the wall of the uterus consists of three layers: endometrium, the inner epithelial layer, myometrium, smooth muscle layer, and perimetrium, serous layer, and cover the outer surface of the uterus. Now, what we mean by endometriosis? Endometriosis is defined by the presence of endometrial tissue, a gland, and stroma in a location outside the uterus endometrium. This tissue is not only morphologically similar to the normal endometrium, but is also functionally. It's typically a disease of the reproductive years and affect about 5 to 15% women of reproductive age, and the peak incidence about 30 to 45 years of age. Now we talk about the site of the endometriosis. Endometriosis may be located in the pelvic or extrapelvic location, like here. In the pelvic, in uterine, causes adenomyosis. Means by the adenomyosis, the growth of the endometrial cell in myometrium lead to the hypertrophy of the myometrium, and maybe in the ovary, pelvic peritoneum, fallopian tube, bladder, and rectum. In the extrapelvic, like in the lung pleura, diaphragm, brain, and skin. There are many theories to explain how the endometriosis occurs. Some of them, regurgitation theory, propose that a menstrual bag flow through the fallopian tube lead to implantation. Metaplastic theory posite the transformation of the coulommic epithelium into endometrial tissue. But these two theories cannot explain lesion in the lymph node, skeletal muscle, or lung. So there is another theories, like vascular or lymphatic dissemination theory, has been involved to explain extrapelvic or intranodal implant. Young girls with obstructive anomalies of the genital tract often develop endometriosis. And finally, immunological factor reduce the clearance of the endometrial cell due to the decrease in natural killer cell activity or decrease in macrophage activity. And now we talk about the pathophysiology of the endometriosis. When the endometriotic tissue exhibits increased level of the inflammatory mediator, mainly prostaglandin E2, and increased estrogen production due to the high aromatase activity of the stroma cell, this change enhances the persistence of the endometriotic tissue within a foreign location. So when there is an increased level of the estrogen, lead to the endometrial tissue that is located outside the uterus thicken, break down, and bleed each month. And so the blood cannot exit the body and become trapped. This leads to cyst formation or may cause irritation of the surrounding tissue. If it causes irritation to the surrounding tissue, it may lead to the pain. Or in the formation of the cyst, it may lead to the obstruction, scar tissue, adhesion, and this may cause infertility. Now we summarize all previous explanation in this video. In the preparation of ovulation, the lining of the uterus of the endometrium thickens. If fertilization does not occur, the uterus sheath its lining through the vagina. This is known as menstruation. In endometriosis, as the endometrium grows outside of the uterus, one cause of this growth may be retrograde menstruation. The menstrual fluid flows backward into the fallopian tube instead of leaving the body through the vagina. Because the fallopian tube are open-ended, the menstrual bag of flow can spill into the pelvic cavity. Bag of flow of the menstrual fluid may promote the transfer of clumped endometrial cell to other tissue in the pelvis. or menstrual fluid in the pelvic cavity could transform part of this tissue into endometrial cell. In the other process, the glands of the endometrium may start to grow on the tissue lining your pelvic cavity, as well as your fallopian tube, ovaries, and large intestine. This growth continues to act as it normally would during a menstrual cycle, thickens, break down, and bleed each bone. Because nowhere for the blood from this displaced tissue to exit your body, it becomes trapped. The trapped blood may lead to the cyst, scar tissue, and adhesion abnormal tissue that bind organ together. The scarring from the endometriosis can block your fallopian tube. The blocked tube may keep sperm cell from reaching and fertilizing the egg, so causing fertility problem. The menstrual fluid could alter some type of the cell in the pelvic cavity to change their structure. All clumps of the endometrial tissue contained in the menstrual fluid could stick to the tissue it lands on and start to grow. In other case, this may be a factor in causing endometriosis.
Hi everyone, I am Fatema Zahraa Abdullah, a third-year medical student. I will keep talking about the endometriosis. What are the factors that cause the disease? Start with the family history. If someone in your family has endometriosis, your risk for developing it is 7 to 10 times higher. Also, the age most commonly occur between 30 to 40 years. And in the menstrual cycle characteristics like early menarche or late menopause or the short menstrual cycle. In the abdominal surgery like caesarean delivery and nulliparity and also immune system disorder which are lead to the endometriosis. Morphology. Here we can see the cross-section of uterus which are demonstrated the endometriosis. In areas of endometriosis, the blood is darker and gives the small foci of endometriosis. It's the appearance of powder pairs, and the small foci are seen just under the serosa of the posterior uterus in the pouch of Douglas. The chocolate cyst. What does we mean about the chocolate cyst? This is a section through an enlarged 12 cm ovary to demonstrate a cystic cavity filled with the old blood typical for endometriosis, with formation of an endometriotic or chocolate cyst. The hemorrhage from endometriosis into the ovary may give rise to a large chocolate cyst, so named because the old in the cystic space formed by the hemorrhage is broken down to produce much hemosiderin and brown to black in color. Histologically, this picture demonstrates the microscopical appearance of the endometriosis. The diagnosis is simple and rests on identification of foci of the endometrial glands and stroma, and we can also the old or new hemorrhages, hemosiderin-laden macrophages, and surrounding zone of inflammation and fibrosis. Now, what about the symptoms of the endometriosis? The patient with endometriosis may be asymptomatic, but symptoms often related to the implantation site in the gynecological, which are lead to the dyspareunia, dysmenorrhea, menorrhagia, and pelvic pain, but in the bowel, which are lead to the constipation and hematochezia. If it's occur in the bladder, which are lead to the hematuria and painful urination, but if it is occur in the thoracic, which are lead to the hemoptysis and the bronchospasm. How do we diagnose of the endometriosis? A healthcare provider first may do physical exam, include a pelvic exam, ultrasound in the abdominal, transvaginal ultrasonography, MRI if the ultrasound finding inclusive, and biopsy, a small amount of tissue is removed, and laparoscopy is the only way to tell for sure that you have endometriosis. And thank you for your listening.